I'm Jennifer Slonick, a nurse practitioner of the Mayo Clinic here in Scottsdale, Arizona. Natasha Mendez to my left and Catherine Barr to my right. My colleagues are also nurse practitioners. And we will be talking to you and hopefully taking your questions regarding interventional therapies for the treatment of migraine headaches. These injections are typically done as an adjunct to the traditional therapies, which is medication therapies. In addition, we can do these therapies to reduce the use of rescue medications, and also in patients who are intolerant or are not able to take or partially respond to traditional therapies, these are a good adjunct. So I will briefly explain to you the supraorbital and the supratrochlear nerve blocks. These are performed in the forehead right above the eyebrow. The nerves that are blocked are the supratrochlear and the supraorbital nerve blocks, which provide sensation to the forehead. So by blocking these nerves, we provide local anesthesia and relief of pain. And in the long run, we hope to have the pain signal interrupted so that it does not carry those pain receptors and pain signals to the central nervous system, thus giving you long-term relief of your head pain. In addition to these two blocks, there's also the occipital nerve blocks. These are performed in the back of the head. The nerves that we block here are the greater and the lesser occipital nerves. The pain that is associated with these nerves is called occipital neuralgia, and pain typically starts in the back of the head and radiates forward. Then the other blocks that we perform is called the auricular temporal nerve block. This block is performed, right in front of the ear, anterior, in front of the tragus, which is this part of the ear. And then this provides relief in the side of the head, or the temporal part of the head. And lastly, it's the SPG, or the sphenopalatine nerve block. And this is performed intranasally. So it's lidocaine, which is the numbing medication. It's actually through a catheter inserted through the nostril, and the medication ends up in the back of the nose, providing anesthesia in the part of the nerve that carries the pain signals back to the central nervous system. So at this point, I know that was very brief. Some of the contraindications of the reasons why we would not do these procedures would be if somebody is allergic to the medication itself. Pregnancy would be a reason to not do these blocks. Also, if you're nursing and if there's a local infection in the region where we would be performing the block, or if there's anatomical or a bony abnormality.
Well, I do want to add, we do have some options for pregnancy using lidocaine.
Yes, that is correct.